Right, so welcome folks today. This is the last of the What I Wish I Knew presentations for 2023. And with us today is Elizabeth Biz Steinberg, representing CAP SLO. Biz has been in the network for more than a couple of years and has some experience to share with us today. Biz is also highly recognized in the network, and it's a real treat to hear from someone whose perspective is valued so greatly across not just California, but across the country, and expanding outside of community action into some of the other areas that touch community action. So very happy that Biz is here with us today. And I'll let her further explain some of the things that she's here to talk about and get things going. So welcome everyone and welcome Biz.
Thank you, Lawrence, and thanks for doing the share a screen and getting me organized and pushing the button. We have an overview kind of outline, but when I think back to when I was new and I came into my role, having been the Head Start director, having been in being exposed to community action while I was in college at the University of Wisconsin in Madison, where I actually did student teaching in a Head Start center where the bilingual language was Norwegian outside of Madison, Wisconsin, under the Community Action Agency back in 1972. That's my route. I say route singular. Followed a future husband to California and have been within community action since 1978 in 3 jobs. So I'm going to jump into our presentation, and you can go to the next slide. Being this turned into our lunch meeting, I'm going to touch on these areas and have, will they get the PowerPoint too, Lawrence, or the record? Just they could go to the recording.
Both
Okay,
will be
good.
available.
So you don't have to take notes unless you want to jot down a question, which I'll try to get through the presentation and then take questions, Kelly, or Katrina, but if you have a burning question, put your hand up and Lawrence will flag me. So I'm going to start with poverty in America, jump into Roma a little bit. And I did all this based on when I look back. So programs are important, partnerships, collaboration, alphabet soup, questions. So I think we'll just get started. The one statement I would make from my early days is there was no ED, new ED training or anything in 1984 for me. When I was in 2 jobs before I became this executive director, which they then changed the title to CEO a few years back. So we all know how the Economic Opportunity Act began 1964. We're celebrating for the next few years because everybody joined at different times in their counties. We are direct service providers, we're advocates, and we do everything we can to affect institutional change. We are a living laboratory. Okay, you want to jump? So all of this, and I know that you've heard this before, but we are America's Poverty Fighting Network. We have a real purpose. We're moving towards self-sufficiency. There's about 1,000 of us. And from the CAP provided services, you can see these statistics, and those have gone up now in the last couple of years. So we are serving people with disabilities. We're serving children, seniors, low-income individuals, veterans, unhoused. The complexity of our poverty has only gotten more complex, actually. Okay, next slide. The book by Michael Harrington, this was from an original workshop I went to in Las Vegas in 1981 as a Head Start director. talking about the conditions of poverty, 20%. And a lot of the research and sharing was from Appalachia. And of course, the White House was really concerned with ways to grow the economy, have people get jobs, and look at the local community. That's what was so unique about the Economic Opportunity Act. Now, today, I don't know what our poverty rate is today. You know, and I always focus on my own county. So we're down to 13%, but it's still challenging in our country. So we're never done. I was an idealist. I thought I'd work myself out of a job. Not the case. I'm still here. Okay, next slide. So we all know our wonderful champion, Sargent Shriver. Johnson declared the war on poverty. We've got our Economic Opportunity Act, and all these programs were put under Sargent Shriver. He had been known for the Peace Corps, and I've heard the tape in Austin, Texas at the LBJ Library, where he's on the phone with Shriver, and he said, okay, Sarge, I need you to take on Head Start and community action, but I've got Peace Corps. He said, I need you to do this. He said, Shriver said, I have to talk to Ethel. I give you 10 minutes, LBJ said to him. Well, he came out and championed all of these programs that are still many are still in our society. But this was controversial because of our board structure, having 1/3 public, 1/3 private, 1/3 low income or people representing low income. Maximum feasible participation by the poor. And I don't know, Kelly, if you're a CCAP or Katrina, but this is part of the education that happens with CCAPs. And now you know what I realized, Lawrence? Because I practiced this, I don't want to take more time than I should. So I'm going to speed up a little so we have time for questions. But this is sort of our baseline. And we all developed, I just got my articles out yesterday because we were double checking. Our date of incorporation was December 8th, 1965. So in 2025 will be our 60th. And I think everybody's looking at their date now. And it happened, my board of supervisors here, they have left it with a nonprofit, us, for all these years. We work with the county government, city governments, and they're representative on our board of directors. So that was a key phrase from that period of time. And thank goodness we had Sargent Shriver at the helm. Okay, next slide. I'm not going to show the video, but you can all take a look. If you go under Sargent Shriver, you can see the original film of this famous beginning that was shared on video from back in the day. But we'll skip that and go to the next slide. You all know, and then the next slide, Roma. I bring Roma up because it's what we are all going by with CSD for our community services block grant. I use this as an example. Whenever there's a work group, I make sure I have somebody on the work group from my team. And so in '94, I had my planning director be part of this monitoring and assessment task force at the state level so that we knew what were they talking about, how can we influence it, how can we poke holes, what's good, that kind of thing. So Roma became our the implementation of comprehensive performance-based management system for CAPS. Next slide. And you all know about Roma. And this is the cycle, and my board loves that we have a cycle of Roma, if you can believe that, but they really do. We do the assessment, we plan, we implement, we look at our results, we evaluate, and we're back to assessing what's next. So I know this is a familiar slide. Next slide. And this just is another picture of it, starting at the bottom of the triangle with community assessments leading up to services and activities, which fit into the direct service part of community action, based on the needs in your unique community. What's needed in Alpine is different than and I'm in 11 counties, even though we're the cap only for San Luis Obispo. Okay, next slide. This is annual requirements, and I encourage you to have your 2 people attend the training we just heard about. It's going to be July 17th or January 17th and 18th, I think. And it's going to go through the indicators, your annual program report, our accomplishments. So it's important for all the new EDs. I even wrote and asked for one more spot for my newer development and outreach director who oversees planning and CSBG grants. So I draw your attention to get signed up for that, or have your Roma trainer or whoever is representing you, who's most appropriate to go. You will know who that is. Okay, next slide. We're not as high up on the number of CCAPs. Our director, though, of planning, outreach and development is a CCAP. My deputy director had it. I started it 3 times. I'm just being honest. Life happens, and so I have not achieved that. I've had 2 Roma implementers they're getting recertified. So I encourage you to really see, especially after this training, you might find out who in your planning staff or who on your team is most appropriate. Then we focused on Pathways to Excellence. Took us 7 years. I'd give anything to have been around with the tier system. It's much more phased out, so you aren't overwhelmed with everything at once. We applied, in 2005 or something, 6 maybe. And then we got serious and finished Pathways, and in August of 2016 received the award for excellence at the national conference. I do chair the Commission on Excellence. This is my last year to chair it. I'm your Region 9 rep this year. I got a bonus year, which is nice for me to continue. I do chair the Head Start Task Force for the partnership as a board member. So I'm trying to expose you to how these things link. CCAP and Pathways to Excellence are 2 signature programs of the partnership. And when you're new, you've got to take care of home base, which is why I'm focused on home base today. But there are opportunities to be more involved, be part of a learning community, maybe take one of the workshops on CCAP when you go to a conference. And you have to budget for the conferences. Okay, next slide. So let's talk about who's CAPSLO and what we do. Next slide is our timeline from back in the day. You'll see 1964. You want to go back 1? 2? 1 more. Oh, the timeline should be next. There it is. So you can see President Johnson there. That's from that clip, that photo is. And as we have not updated ours since the 50th anniversary. So we have work to do. These are the kind of things, activities that we can forget about. We need to add our 40 Prado. You can see when we added our homeless services division, when I became the director, when Steve left, when we started weatherization, childcare, our health and prevention, reproductive health clinics. Our last formal program was supportive services for veterans families, and that has just grown and grown and grown. We changed our name in 2009 after a community study. I don't jump, we all have our personal approaches of being a director. I didn't want to jump in and say we're changing our name. But I was on the board of the partnership as we went through the process of evaluating and how to have a national brand. So it took about 6 months for my community program. These were people, this was the superintendent of schools, my board president, our community college, a member of the board of supervisors. We had about 15, a real estate guy, just a broad-based group to look at the name. We were the Economic Opportunity Commission. The first thing they said when they started interviewing people in the community, even at the grocery store, that sounds like a government place. Is that part of our local government? So it created more questions. So then they did follow up, and to make a long story shorter, the board adopted the change to Community Action Partnership of San Luis Obispo in, I think it was November of 2009. And then we changed all of our letterhead and all of our everything. And now everybody just knows us in our community, which they helped create that. And the message was out. So I encourage people to be able to at least have community action in their name. And at the national level, we are struggling. We're really trying to have more people have their agencies, have our heart. And then the next couple, 3 slides are our mission, our vision. The promise, we read it at every meeting. I hope you do too. Next one. And that's from the partnership. Our vision is very important to me, creating communities where all people have equal opportunities to achieve self-sufficiency. I think that is as simply said as it can be. And then our mission. And next is our, I think, our values. And this was done agency-wide by 800 people, broken down in centers, programs, all the different programs that we operate, and this is what we came up with from all of our staff, and then the board reviewed it, tweaked it a little. So core values, communication, they haven't changed. We can't find a better way to say it. Honesty and integrity, respect and fairness, teamwork and collaboration, positive attitude and energy, and professionalism. So I share those right from where the rubber meets the road in serving our low-income vulnerable populations. Okay, Lawrence. Next is my org chart, I believe. So you will see, and I'll spend just a minute. The key is our board of directors. The tripartite board of directors is the most consistent part of the original Economic Opportunity Act. And I value the board of directors, the diversity, their varying areas of expertise, and we run by committee. But we meet every month except July, and we have been meeting for 58 years on the third Thursday of the month, if you can believe that. It's true. So we have the audit committee, planning committee, executive committee, HR, finance, and then the board members choose to be a liaison to one of the programs. So last night at the board meeting, our CSD rep reported on energy. Our low-income rep from Los Osos did an update on the migrant and seasonal Head Start. They find their niche and they become like the board expert of that program. Now, ad hoc, we have right now the nomination committee is setting up interviews for January, and that they'll refer to the board selection group on who they recommend. It's important to always advertise for any new people that, you know, I like to have a little waiting list. I do not get involved in the interviews. My director of communications has all the links with all the people that are being interviewed. She sets up with the board selection group when the interviews will be for the different people that have applied. And I think and we try to get the word out wherever we can. But our HR committee's got 3 people, the executive has got 5, planning 4, audit 3, finance 5, and then many of them are a liaison. Here I am. I report to that 15-member board of directors like you report to yours. We have 2 policy councils because we have migrant and seasonal Head Start that operates more March to October, and the regional Head Start Policy Council operates all year round. So you'll see this biggest addition for me was the community programs director, because I had all of the programs under Lauren and my admins, all the admin. So I have the 2 program people are community programs director and child and family services. So all the state and federal child and family programs are here. And Lauren has all the other diverse programs that we operate. My COO has facilities in IT and HR. It's the first time I haven't had HR under me directly. I do have the CFO and the outreach and development. So I have 1, 2, 3. I have Marcy, and she oversees communications, oversees communication, front office, volunteers, and wellness. So I still have 7 reports, but that's a lot better than 12, 13. CFO has got all of finance, AP, purchasing, etc. COO also covers legal for me as my consultant on legal issues. So it's, and then we support over 1,000 employees with this structure. So the programs are under each of the program heads. You know, I didn't get into the minutia, it's quite complex, but it makes sense to me. But this is what I thought you might be the most interested in. And as your agency grows or shrinks, you have to be ready to move around and restructure, which I've done a few times since 84. In 84, I had $3 million and 75 employees. Today, we just went over 1,000 employees, 11 counties, and about $120 million. So we'll go to the next one where I get into the programs. Everybody has heard about Head Start and childcare, and I braid all the dollars to offer the families the maximum number of hours we can provide, how they are out working, seeking work from birth to 5. And then when I jump to another, so this is Head Start, early Head Start, and the partnerships for regional and migrant. So region 9 and 12 is what I have here. Next slide is our early care and education. includes state child development. We've got every grant there is for our state child development, and we are the alternative payment and resource and referral for our county as well. So $23 million of our 125 is state child development. Migrant is 44. I'm very focused on early care and education and their families, okay? That's kind of where I came from, and I look to all my programs in CAPSLO as families to be served, from infants, prenatal, all the way to our elders who are in our adult day program. Next slide. Oh, I'll skip. This is just the next two sheets are handy for people with Head Start and following the governance structure. And I'm going to jump past the next two. And we'll go to Child Care Resource Connection. During COVID, we increased, because of the state funding, the number of children that we serve. We spend $1,100,000 a month, and it's growing, to serve those 1,500 plus children in subsidized care from birth to age 12. It includes parental choice. Parents might pick the YMCA program at their school. They might pick a church program. It's up to them. And then, of course, the groups that we subsidize, they are grateful to be on the contract system with us. We also have the resource and referral, do a lot of training, help people. We have the family and center-based food programs. So we are training providers to offer childcare in their homes and in centers. And during COVID, we were having meetings about masking and children and health checks. So having them all in our agency has been very helpful to the community. Next slide. Our family and community support. This is a county-driven, and Melinda and our colleague from the Department of Social Services did a workshop at CalCAPA's conference on differential response. We have the funding for child abuse prevention from the Department of Social Services for the last 20 years. We operate the safe services. That's where probation, education, CAPSLO, we all are a team, a multidisciplinary team, to help a family plan what situation given the situation they're in, how can we help them with their children? We have the Teen Academic Parenting Program. We have on DocuSupport, just whatever is needed as families change in our community. That's the role of our family and community support. And they are built, this is built to support all of the early care and education too, but the children go from 0 to whatever, all the way through teen parents. Okay, next slide. This is Lauren's programs that I was able to give to him that I used to oversee. So he's been on staff now 2 years, and it just makes a wonderful division of labor. So he has adult day, energy, weatherization, health. We still have reproductive health clinics, one in our South County, one in Central. We own both those clinics. We also do the charter school at the National Guard called Grizzly Academy, and 2 community colleges, Cuesta College in San Luis County, Hancock College in Santa Barbara County. We offer health services to all the students. Homeless services, we are most noted for 40 Prado to give access to all unhoused folks. We run shelter there, but we just won an award for our recuperative care program, people coming out of the hospital. Are cared for by our nurse and our staff. The federally qualified health center is right on in our building with us in a clinic setting. We also help build the county's detox facility that is on our campus. So we collect rent from them. We do not do the program. They have an expert group there. But the county asked us, after we built our $5 million homeless center, could you build for us the detox program? So I bring that up because you never know what you might get asked to do. And we did it willingly in partnership, but it was Christmas of the first COVID year. And the supply chain had been backing up, and we had to come up with $347,000 more was costing. So the Bank of America Foundation, who we work closely with, funded us over 2 years, $250,000 to help close that. Relationships. So as I'm talking, I'm just making some observations of the programs we run. Relationships in all these programs, plus the children and family, the partnerships, because we in Community Action can't do everything, but we can partner on many things. And we also can spin off something. We had a children's assessment center that we founded because it was so needed. But then it was all this Medi-Cal billing. So about 5 years ago, we spun that back to the county because they could be most efficient. And I just guaranteed that our early Head Start children could still be seen there in case their parent was the baby was drug exposed during pregnancy. So we also, do those kinds of development. The veterans, our county was one of the last counties to get the support of the VA. And the VA funds this, as well as our elders at the Adult Day Center who have been in the service. Their fees are paid by the VA. So you can see that we have a lot of funding resource bases, federal government, state government, local government, donations, but from many federal and state departments. Our next slide goes in a little bit more on each of these. So we have the elderly in this wonderful home-like setting. They have either Alzheimer's or dementia. And during COVID, we had to have them separate. We couldn't have them sit together at tables. They missed their friends, but we are also doing caregiver workshops every quarter, and the participants is usually the person caring for the elder with the Alzheimer's. They can bring their family member who has care all day while they're in workshops, have lunch, talk with others, and this is a growing challenge. We need another site or two for this, but the Area Agency on Aging doesn't fund it. I'm looking for where in the world we can get money, because the over 80-year-old, over 75-year-old age group is growing fast. They're living longer, and they have sometimes Alzheimer's or dementia. Okay. Energy weatherization, you're probably familiar with that. We also have minor home repair funded by the Area Agency on Aging, our utility assistance. We're always remaking homes to be accessible. It helps our elders stay in their own home and not be in a nursing home. Reproductive clinics are next. As I said, we have 2, and we are in school-based health programs all over. We worked hard to prevent intimate partner violence, and we work with our local entity that has that expertise. And our tattoo removal program probably gets more people back to work faster than anything else we do. Donated time by dermatologists. In our clinic, we need a new laser machine now, but we're trying to figure out where we're going to get funding for that. But we have been in existence with reproductive. We've sued Governor Deukmejian, won back 24 of the 36 million he threatened to cut. It was a class action lawsuit. Remember, I mentioned advocacy. So two of our patients were the clients in the lawsuit. And today, Family Pact is at about 400 million because of our saving that first 24. And we did that in partnership with Planned Parenthood, Public Health, and a couple of other private OBGYN doctors. Okay, I'm running a race now. Next slide is so here's a picture of 40 Prado and the courtyard. And I mentioned the services provided there. It's really access to an emergency night shelter. We have warming center when it hits 38 degrees or it's raining. In the storms last January and March, we were full, bed to bed, cot to cot. Tulare, Kern, a bunch of CAPs have come. We've let the plans go to whoever wants them. And Tulare is actually using our architect too to do theirs. But 80% of the money to build this was raised through our local private donors. 20% was government. That is rare that it be that percentage. Okay, Lawrence. Veterans, we're just doing everything to get veterans home, and we're doing a good job at that. I'll jump to fund development. I'll be quick on these because we need time for questions. Lauren she attended the Cornell course that Cal Kappa offered, and she finished her CCAP. So she is she came from the American Red Cross. She is really immersed in community action, and we appreciate those opportunities for her from Cal Kappa. She started our DEI committee in June of COVID year 2020. We have participants from all our programs who are interested. She oversees planning and development and donors and all that goes with that. It's a big job. Next is my Chief Operations Officer. So she has IT, HR, facilities. That's everything. That's the back of everything that we do. IT is in 80, we have IT in 80 sites across our 11 counties. HR for 1,000. I mentioned facilities is the same amount as IT. And then she oversees our employee council, which is a group of another employee group. I really have worked hard to have employees involved in what we do and have ideas come from them. I learned that from Eastern Idaho when we were going through pathways. Next will be Marcy, our communications director. We have I still have live voices answer our phones. I will not go to a machine. People who call us are desperate. So Marcy oversees the front desk with Rosa and Carlotta. If you're ever here visiting us, they are the first people you meet. They are the first people on the phone. They are the first warm voice that someone might hear. Marcy works with the volunteers, donations, and our wellness committee, which is, again, another employee-based group. Finance, I have a 2-page, it's so complex for finance that you can go to the first page. When you get this PowerPoint, you will see our expenses. This is for when we were approving our agency-wide budget last March. It's already going to be higher. So this, you'll get a sense of all our programs, the amounts of dollars, and then the next page will have all of our income. Well, you'll get a sense of, like here's Family Pact and Medi-Cal revenue. Federal revenue is all of federal revenue, but split by the programs that receive it with some notes. My indirect cost rate is 8%. Next is our map. So I can show, we go from San Joaquin with State Child Development, Migrant Head Start, all the way to San Diego, where we have Regional Head Start. We have energy and PG&E programs in San Benito, Monterey, San Luis, North Santa Barbara, and sometimes a little of Santa Cruz. So that's my spread. And the 24,000 is going up for, it's going to go up because I used this slide from 2 years ago. But we're always helping people, changing lives, which is the partnership slogan. And our executive team and senior management are on the next slide. I was just with all of them at a breakfast. You can skip this one, Lawrence. That's all of central admin. Here's the real people. And the next slide are the three groups that I really like employee input. And we have done, I think, a very good job listening to our employees. We listen through our employee survey, and it helps us plan for the future. And the next picture should say now 1005 staff. They're waiting for us to do an all capsule day. Here are my board members that were there that night. And welcome again to Community Action. There's our tripartite board with a few people absent. So maybe we can go to the pictures for the last 12 minutes. Skip the pictures and we'll stop the sharing and I can be face to face with you. And I hope those that were registered will get this. And so but Kelly, I'm glad you were here and you as well, Katrina. Thank you. Questions any of you have? You too, Lawrence. What I didn't mention that was on the alphabet soup that's on the front page, I just wanted you to know, I kept mentioning the partnership, that's NCAP. You know Cal Kappa because we're here with Lawrence. Cap Law is the legal group that was set up by David Bradley and two originators after NCAP was set up. I forgot NCAP because we were at his meeting. I forgot to put that down. NHSA, I'm a member, my team is because of all the Head Start dollars we receive. Region 9, you need to know Region 9 for community action and Head Start. I guess and energy and LIHEAP and all of that. We're part of a regional association. That's what I knew. I wish I would have known more to understand how it's all organized back when I started. And then NUAC, I'm just learning about NUAC with the energy programs. So I think I covered my slides and I want to answer your questions.
I had one question. So you have no use for an answering machine. That's one of the things that was clear for me. So you have a 24-hour line where folks can reach, or?
No, 8 to 5, a business hour, but then we have a backup for the evenings and we have a hotline through a local county group that takes messages for nonprofits and we get them the next morning.
Okay.
But no, during the business day, I have live coverage.
And then your tattoo removal program, I don't think I've seen another agency. So can you tell me a little bit about that? Because that's very unique and wow, that's impressive as well.
Our probation department presented to our board maybe 22 years ago. They wondered if we'd be interested in operating because people have socially inappropriate tattoos that they got maybe when they were 15 or 16 or 17. Yeah. But here's what it takes. We have one coordinator quarter time. It's about 70,000 for the staffing. Every member who wants a tattoo removed does 16 hours of a volunteer. They can pick whatever nonprofit they want to give time to. And for the most I think we've ever had, one of a past drug lord in one part of our county had 46 tattoos removed over time. And he was 46 years of age at the time. But he had come into me after this was all done, and he didn't have to wear a turtleneck. He didn't have to wear sleeves, and he got a job at one of the grocery stores in South County. We did, one of our coordinators was a photographer, and we took a display to our local art center, and then we took it to Philadelphia, to the partnership conference, the last one in Philadelphia. And we had an art show, and we had our coordinator there and a couple of our participants. What the participants tell me is, I never had this feeling of giving to somebody else, of helping those middle school kids. Now I tell them, I don't want you to do these. So they're turning into mentors, and they are so grateful for the removals. And we have, as of last night, we have 4 dermatologists, so they do once a quarter each on Saturday. And we have volunteers that get the wrappings ready, etc. It's quite a and then, but the stories before and after are the most moving that I could tell you about. It's been a wonderful, it's a big investment because we got to keep that machine tip top. We've got to keep our dermatologists. Here they are donating their time. It's built on, we're big on volunteerism here. And the results have been exquisite.
That is awesome.
They donate for each treatment, 16 hours.
And then I saw the timeline. 1972 was before Roe versus Wade.
Yes,
That was probably very controversial to have the reproductive health program back then.
It was, and I wasn't here then, but I sure heard about it. And then when Roe v. Wade came in 1 year later, made things much more, I'm not ever going to say easy. It was always hard. But now we are in the schools. We're in this Grizzly Academy, which is a charter school under the County Office of Education and the National Guard. And they just can't believe how we can do all this work for their teens.
Yeah, I saw a few
cover
programs.
Women's health. We work with our federally qualified health center for pregnancy and maternity. We don't do that, but and we have PrEP, all the different supporting services around HIV/AIDS. I can when I think of AIDS, I can tell you that I called the regional office in San Francisco when I was a Head Start director. We had our first little guy with AIDS from a blood transfusion. And I asked them how I begin to handle this. And they said to me, Biz, we'll learn what you and your public health department come up with because we can't tell you. That's how it was. And the little boy's name was famous because he was the first young child in our state. But and our staff, we have young staff in our teen clinics. The unintended consequence, they go on to college and come back as nurses or biologists, or it's just been an amazing venture. Planned Parenthood wanted to buy our clinics in maybe 87 or whatever, but our board said, no, we're going to keep doing this. We were committed to reproductive health for men and women. We have about 25% of our caseload are men.
That's interesting.
And there used to be 4 CAPs that had reproductive health: Sonoma, Kern, San Luis Obispo, and one more. Jeremy sold his. I don't know what Sonoma did. I think they merged something up there, and we just kept ours.
And so you're in 11 counties. That has to be.
You know, I depend on my area managers, and I make visits. My board members make visits. We just can't, you know, in the last couple months, we've been in Monterey, Kern, Fresno, Santa Barbara, and San Luis. San Joaquin will be in the winter. San Diego will be in January. So we have a rotating schedule. We're always, and during COVID, Marcy came up with the Biz Buzz. So every week I was on video with everybody that could be on at a certain time. And then we went to once a month after the first year. But communication between myself and my team with every employee is the most important. And we're always improving because nothing's perfect. And when I say communication, I mean that instructional aide, the shelter worker, the teen counselor, whoever, because they're the most important. I always talk to them about a bicycle wheel with the spokes that go into the center. And I sit in that little center, but with my team of central admin and the senior program directors. But around the wheel is where it's the most important, but we're all connected. So that's my little analogy for how we all work together and keep it together, but we'll have a flat tire sometimes. You know?
Thank you so much. This has been really informative, not only about the services that you all offer, but just the impact that you make within those communities and the programs. Oh my gosh, just amazing.
You'll have to come visit, Katrina.
I will. Next time David's out there, I'll make him take me with him.
Kelly, can I answer anything for you?
No, I don't have any questions. Your presentation was wonderful. I learned a lot, and I just took a lot in of what you said, and just knowing where my agency is at, where we went, where we are now, where we're trying to stabilize. I mean, it's amazing to hear what you guys have done, and it is so encouraging that I know that I can take a lot of this back to our agency, and as we're restructuring, just put that positive energy out there and get those success stories. Like, it was great to hear those success stories. We don't have many of them. So
You know
nice.
what? And if I can help in any way, just call me.
Thank
If I
you.
can help in any way, I'm happy to. I have gone to other agencies, you know, just informal, nothing formal, informal.
Thank you so much. I appreciate it. It was wonderful.
Thank you. Lawrence, you got any questions?
Biz, we've got maybe a couple of minutes left. I was hoping you might speak a little bit to, you talked about some of the groups that you find yourself on as a leader nationally, right? So if you could maybe speak to how you find yourself in those situations and how aspiring directors might, you know, steer toward those national groups and being involved.
You know, in the beginning, I had a lot on the plate. I mean, we weren't in a good spot in 84. Anyway, I had to untangle the old for-profit side that my boss had put into effect on things we didn't know how to do. So once I got that untangled, I would say, you got to first take care of home. You got to know, the board's got to understand and work with you and your team on what is the plan forward. And it can't be grandiose. You've got to be reasonable. about what can be done in a year to 3 years. I had a mentor named Lois Carson. I met her at Cal Neva, which is the predecessor of Cal Kappa. I learned to go to conferences, and whenever she'd be talking, I'd go. And then she would say, Biz, are your kids old enough yet? Can I encourage mentorship. But my youngest was challenging. So I said, Lois, maybe when she hits being a junior or so in high school. Well, Lois wanted me to run to be the regional rep, which I now am again. And with her encouragement, I did it. And through that, I got to know the Cal Neva board, which really went through a rough spot. We are in such better shape today with David and Lawrence, and we've got an active board. Which I think COVID brought us closer, and I've been honored to serve on that board. But I learned through, once we had enough money where I could take a couple people to Cal Neva or the Head Start conference, you got to know your funders, relationships. When you go to a conference, the funder from Office of Head Start's going to be there. The Office of Community Services will be at the national one. So it's a matter of being online with those organizations or learning through your state association. State associations have become extremely important because they're the bridge for all of us to the national partnership, to our regional association, and we're helping our regional association get stronger too. And then depending what programs you have, so I'm going to Head Start, I'm going to NHSA, I'm going to my migrant and seasonal. Through my migrant and seasonal association, I was able to serve as their rep on the NHSA board, the National Head Start. So it's getting to know people, but how these things are organized. And I didn't know that in the beginning, I have to say. I just started where I was. And then as I learned a little more, I hope I'm answering this. It was our state association that was my first. I went to my first conference in 81 or 84 maybe, in Las Vegas, and got a sense then of this community action nationwide. And it was cheap. I could fly up there quick. I couldn't afford to go to Boston or somewhere that costs more. So it comes down to you budgeting for these training opportunities and offering presentations. Sometimes there's not a fee if you do a workshop. So I got smarter at that, doing a workshop on whatever. For me, quality early childhood was I'm an emeritus professor from our community college here. I taught 27 years at night in early care and education family studies, where I hired a lot of my people. So I had a little insight there. My stories, I could go on and on. But attend when you can afford it. Stay tied to Lawrence and David and Sarah and Katrina at Cal Kappa, because they will bring us the info. And then there's David Bradley, our lobbyist. And I'm sorry, I left NCAP off. Please add that. He is our advocate. He got us $1 billion during COVID. And he also wrote the CSBG block grant in 1981 when they were going to eliminate us. So he has been bringing in the bacon for us, and we need to support him with Club 199 if you can, or if your organization can afford the $1,000 for CapVax. It's a legal way you can spend money to get those, and that helps on his budget side. Now I took 5 minutes for that. I'm sorry. I can go for a long time because I'm old and I've been through 45 years of this.
Well, Biz, we'll have to invite you back for another, another session on another topic.
Sorry we didn't get everybody, but probably changing the time didn't help.
Oh, well, fortunately, we're recording and we've got your presentation document and we have you and your contact information.
I'm happy,
Thank you.
I'm happy to help however I can, visit, talk with you, Kelly or Katrina or Lawrence. So thank you for inviting me, Lawrence, and have a great 2024, all of you.
Thank you, Biz.
Happy New
Okay.
Year, happy holidays. Bye,
Thank you,
everybody.
you too.
you.
Happy
Much.
holidays.
Bye-bye now. Thanks, Lawrence.